Hi guys, it's Dr. Selene with BU Medical. I want to talk to you guys about a technology called Ultherapy. It's been around for a long time. It's something that I've been doing for the past decade almost. And I want to tell you about what it does, what it doesn't do, who it's good for, and I want to show you on my good friend and model, Savannah. So what does Ultherapy do? It's ultrasound technology. So you're going to see in our video here of how I'm using an ultrasound technology to kind of see the underlying tissue. And so what we want to see is where that collagen layer is, and we kind of want to stimulate it with thermal coagulation points that cause a little injury, taking lax collagen that's aged over time. Savannah's in her 30s, so she's lost some of her collagen already. Remember, we start to lose that past 20, so she's continuing to lose it as she ages, and it's lax. What I'm going to do is I'm going to put little thermal coagulation points in that lax, lazy collagen, stimulate it, wake it up, and hopefully as it wakes up, it retracts back up, giving you a lifting appearance. The areas where it works is jawline, brow lift, décolleté, and neck. Remember, I've talked to you guys about other modalities like radio frequency with microneedling are profound, which is always my go-to, but it's got downtime. So it's got swelling associated with it. It involves needles. We give you medications to relax you. If you have no downtime, and you're like, I need to go back on camera, I don't have the opportunity to have downtime, this can only result in bruising. But you don't really walk out swollen or looking like anything happened. I actually think it's one of the secrets for a lot of celebrities who say, I haven't done anything, because it really is using your natural body's response to injury using ultrasound energy. Nothing's getting deposited, nothing's getting injected. It's really just relying on you to lift and tighten. So keep this in mind if you don't want downtime. If you've used this modality before, you have the right expectations. This is a subtle improvement, but it is an improvement, and we'll show you some before and after pictures to show what it can do. So let's show you here on Savannah. So these are the areas that we can treat. So lower face, neck, brow lift, and décolleté. I'm going to show you on Savannah. She's a beautiful skin, so there's not a lot to treat, but I'm going to still show you nonetheless what we would do. So you can see on her chest, number one, the girl has no chest lines. What's wrong with her? I have chest lines, but nonetheless, on a lot of us, we have these lines that go down the chest. This is the area that would get treated with that. So we would mark you out and we would deposit the energy in this location. That's a little tender spot, so keep that in mind. Even though no downtime, it can cause a little bit of pain. But that's kind of the grid that you would see in that location. For her lower face, and on this assessment with Savannah, she's got an amazing jawline. But as she ages, we can see, especially with her Hispanic heritage, and I'm Hispanic too, we tend to fall. We are not big wrinklers, but what we do is we lose our elasticity and we start to fall. We're born with really high cheeks, and that eventually moves down. So if she was like, Selene, I really want an amazing jawline, I would just say, okay, well, if you really want to be proactive, we could pull this up a little bit with Ultherapy. On Savannah, I would almost tend to want to do Ultherapy over profound, because her areas of benefit are so subtle that I feel like what we could do is, if I mark her out here, so you can see this would be her treatment zone as well as her neck. So on her, I would actually have her do this area with a little bit of a pull in here. It would preserve her amazing cheek, and it would tighten up this jawline area, as well as preventatively kind of keep that neck tucked up or snatched. And so it really is a beautiful option. And when I look at Savannah, I think of my celebrities who are like, I don't have downtime. I don't want anything that anybody can notice. I'm willing to wait for the results for 6 months. And that is kind of what we would get. So there's different little transducers we could use. One would be a deep one to kind of give her that lift. The other thing that Savannah is starting to form is some smile lines. Cute, I'm glad she's happy, but over time these will continue to get deeper. And so we'll also use a secondary transducer that will help with fine lines as well. And then everybody wants that really open eye look, and so what we're gonna do today is we're actually going to do a brow lift. So look straight ahead for me, Savannah. And so just in that location alone, you can see if I were to pull that up a hair, it just gives her that bright eye, opened eye look. And it's really quick, it's a really easy procedure, it's a little tender, but it does over time give her a lift. And she'll notice that over the next 3 to 6 months. It's a nice bridge before you go in for your blepharoplasty. Most of us are gonna need to get that excess skin removed, but this is a nice bridge if you're like, I don't have the downtime, I can't have black eyes for 2 weeks. This is a nice bridge until you're ready for that. Okay, so we're just gonna do the brow lift right now. And remember, this is ultrasound technology. So we use ultrasound gel. This is the same technology you had if you had a baby in your belly and somebody was looking for the baby. So if you could see on my screen here, this is just not seeing anything, it's seeing air. But as we go on the tissue, we're gonna see her underlying bone, we're gonna see her underlying tissue, and all of the little structures. We love ultrasound in medicine. It kind of guides us, and that's what I love about Ultherapy over other modalities like thermage. We're actually seeing exactly where the energy is going in. All right, so we completed our treatment of Savannah. You can see how easy that brow lift is. It's not a big deal. It doesn't require numbing. You can see that she looks perfectly fine. There's no evidence that we did anything, and now it's just a matter of time. So now we just wait for her collagen to wake up again, give her that lift those brows, lift that jawline. If somebody wants the décolleté, it's a great area for that as well. This is, remember, the long-term plan. Remember, we're building collagen, so we're avoiding or at least postponing our facelift. And the other things that we can do to help are volumizers with filler and other lasers as well. This is a great one if you don't have the downtime, if you're like, I just want something really organic, really natural, and I'm okay with subtle results, then this is your ticket. So remember guys, we're here to serve you. Come see if you're a candidate for this. Most people are, and most people really like it or they don't. So you'll see on Real Self, there's mixed reviews. I think a lot of it has to do with expectation. I want you to walk in expecting a subtle result, but a long-term result. So come in knowing what you want. If you're satisfied with that, then book it, come in for a consultation. Remember guys, we want you to look great so you can feel great and do great things in this world. Take care. Bye-bye.